According to Dr. Agrengobi, the outreach is part of broader efforts to improve HIV prevention and access to health services among refugees and host communities.
As you see, many people are here. This is like an underserved area, and they are very eager to receive the services we brought. They've gathered. We are handling HIV/AIDS, TB. We are handling eye checks, that is ophthalmology, dental, and the other comprehensive primary health activities. It's a camp that I would feel that we should continue once in a while conducting in this refugee settlement. But the medical camp is not only managing HIV/AIDS testing, it's also we are also testing TB. We are also testing cancer screening for cervical cancer and breast cancer for our women who are the majority.
Officials report that more than 1,300 people were screened for HIV over the 3-day health camp, with other medical conditions treated, including a 2-day emergency surgical operations. The Assistant District Health Officer for Isingiro District, Amos Mutunji, commended the Office of the Prime Minister for organizing the health camp, but urged government to upgrade Nakivale Health Center 3 to Health Center 4 status, citing the increasing patient load.
If it was a health center for staffing, it would up at least many staff who can accommodate it. So we request the government, if in its way they can give us a health center for Nakivale, to make sure that all refugees and other nationals are served at the same time. We also want to increase our coverage, and our coverage in terms of medication, in terms of tracking for babies, for mothers. So all diameters should be touched on.
The Regional Refugee Desk Officer for Southwestern Uganda under the Office of the Prime Minister, Titus Jogo, says Nakivale Refugee Settlement currently hosts about 286,000 refugees across 5 zones, with more arrivals expected. He notes that Nakivale Health Center 3 also serves surrounding Ugandan host communities. However, Jogo cautioned that although the HIV prevalence rate in the settlement stands at 2.4%, there are concerns it could rise due to changing behaviors and reduced food rations.
Because our refugees are getting challenges of coping up, dangerous coping up mechanisms, especially now that their ration has been reduced. They go outside the settlement where transitional sex is taking place, and therefore they are at the risk of getting infected from people outside the settlement in exchange for food and in exchange for money.
Refugee community leaders Paul Mushaho and Madina Wushuru applauded the government of Uganda through the Office of the Prime Minister for continued delivery of health services within the settlement.
On behalf of refugees, we deeply appreciate the service that we have benefited from this medical camp. The people are so happy because they have got the treatment, and those who are going to receive the referrals, they are looking forward to it. And it has come in the right time when we are facing the global crisis about the refugee response.
Mimi lakini nafurahi sana zaidi kama anaendelea hivi anasaidia sisi, mimi nafurahi sana. Asante na karibu anaona sisi. Shukran. Thank you so much. You are coming, you are visiting for us. Thank you so much.
Nakivale Refugee Settlement, a 71 square mile facility established in 1958 in Isingiro District, remains one of Africa's oldest refugee settlements. It operates under Uganda's self-reliance model and hosts approximately 286,000 refugees from countries including the Democratic Republic of Congo, Burundi, Somalia, Rwanda and Ethiopia, who are allocated land for farming and settlement.